thing that I tell you will be absolutely vital to save somebody that you care about, and I'm going to tell you how. And it's real important that you get them here. The way that I accomplish my mission is if I get everybody. It's a sort of like vaccination for suicide. I'm going to inoculate y'all. So can you get, if you have folks you know are missing, can you text them real quick? Also, I do a lot of social media. And so if you want to find me on the Facebook, if you want to get your smartphones out, take pictures, Facebook, I would like to say phones out and active during this presentation. Right, phones out, phones active. I've been texting and Facebook and all about y'all, so, well, not y'all personally, but the presenters. So get your phones out, check your text messages, become engaged. I just want to share a little bit of information. This is the most awkward topic ever, right? And how many stand-downs or how many suicide prevention trainings have you all been to at this point? You've been to a lot, so I'm not going to repeat any of that because I'm going to assume that you can use Google and you know, you've heard that suicide is bad and don't do it, right? You've been there, and I'm not interested in giving you that message again. It's a waste of my time and it's a waste of your time, and it doesn't do what I need it to do. I work for Veterans Affairs, and I'm the suicide prevention coordinator. I'm one of two of them. Dr. Hill's the other one. He's out at a table. And it is our job to stop veterans from dying by suicide in Southeast Louisiana. It is my job to keep people, your fellow soldiers and service members, alive. And I need your help because there are 2 of us in Southeast Louisiana, and I cannot know you all. In my particular VA, I have 14,000 mental health patients, and then every veteran, whether they are a mental health patient or not, it's my job to make sure that fewer and fewer of them die by suicide. We want to make it a never event. I cannot do this without you understanding and doing some things on your own when I can't see and I won't know you're there that will absolutely save lives. Part of my job every day is to make sure people don't die. Whether that is I directly deal with somebody who's violent and armed and wants to kill themselves and other people, which I'm happy to do and I love doing, it's part of my regular job, or part of coming here and helping you understand how to get somebody to help or get somebody to resources quickly and easily and letting you know what the system is that works. Think of this like getting a vaccination, or think of this like CPR training. I'm going to help you make sure that your unit is suicide safer. And there are a couple of reasons for this. First of all, let's be very, very clear about the risk. Overall, in the general population, suicide is the 10th leading cause of death. That's not insignificant. And it used to be that for veterans, suicide was less frequent, but then something happened. And the truth is, we're not entirely sure what. But veterans started dying by suicide more often than the general population. And a huge portion of people who die by suicide in this country, about 20-some%, are veterans. That's y'all. This is a health factor. It'll kill you. It is the most severe outcome of mental illness. And it's very important that we address this. You staying alive matters to me. We have 1 active duty service member who dies by suicide each day. We have 22 veterans who die by suicide each day. That's nearly 1 an hour. People die. That's why I do this job. I decided a long time ago that if I was going to do mental health, we weren't just going to talk about how your girlfriend done left you and how sad that was. I would do something for real, and this is it. So the question is, and this is what people ask me, and this is the question that haunts all of us, the question is, why do people die by suicide? And the truth is, there are whole lots of reasons, right? And you've heard like the symptom list and the warning signs, right? They've told you look for these 10 signs, and they've given you cards, right? Or and like websites, right? No one's giving you a card or website? Okay, good. But I'm going to tell you the basic understanding of how people die by suicide. What we think happens is people experience something called psych ache, intense emotional pain. I love helping people with overwhelming emotional pain because I think that's where I can have the biggest impact. I think that's what matters. And they not only feel intense pain, but they are hopeless. They believe that there is no solution to their intense pain. For some patients who are not well functioning, it can be a hangnail. It can be someone didn't invite them to lunch that day. But for some people, for many of the people I work with, it is that they have not had a job in some time. They're about to be homeless. They have a severe drug addiction, and no one in their family will talk to them, and their dog just died. It can be very serious. It can be very minor, but the experience for the person is intense pain. They don't feel there's any way to solve that. We're going to talk about guns because you guys don't have any feelings about guns, right? We're going to chat about that in just a minute. But we have access to lethal means. What we know is, you know how lots of ladies attempt suicide. As a matter of fact, women attempt suicide 8 times more often than men, but they die much less often than men. You want to know why?
Attention.
No, not cry for help, because if you cry for help by trying to kill yourself, something's wrong. It's not, it's really tempting, and people do this, like even healthcare professionals, they call me up and they go, did they mean it when they overdose? I'm like, yes, they meant it.
No.
A person who's healthy doesn't try to get your attention by trying to kill themselves. A person who is in severe dysfunction does that. But access to something that'll kill you quick and irreversibly that people can't stop or interrupt. Guess what that generally is? Gunshot wound. Guess how many veterans have died by gunshot wound in the last few months? A bunch, because I've had to write the reports. Look at my face. I'm not going to make you surrender your guns. We'll chat about the assault rifle and the safe in my bedroom. I'm not going to make you do that, but I want you to be aware that you are folks who are trained and who all, how many of y'all have guns? Please tell. How many of you have been trained in how to be a responsible gun user? How many of you have guns, have them appropriately cleaned, secured, and taken care of the way that you were trained to do? And what is the attitude towards people who have and use weapons and don't handle them safely or responsibly?
Idiots.
Idiot, right? So here we're going to make a little pact here. You don't have to, but if you want fewer of your folks in this unit and the units around you in Southeast Louisiana to die, this is what you do. You make an agreement with your buddies, and you say, here's the deal. We all agree to be responsible gun owners. We like hunting. I'm from rural Kansas. I have several guns. I know how to shoot those guns. They are properly secured in my house. But if somebody is not doing well, we make an agreement that that gun's going to go somewhere else while they take care of business. If that is, I have severe depression, if I have really severe PTSD, if I have thoughts of hurting myself or other people, then I, as a responsible, trained gun owner, am going to make sure somebody else, one of my pals, hangs on to this for me while I take care of my business, and then when I know I'm safe, then I'm going to use my weapon. Do you use your weapon when it's not safe? No, absolutely not. Is that a reasonable thing to ask? Does not have to involve the government, does not have to involve a background check. What I'm telling you is I hate writing the reports that someone got depressed, something bad happened before anyone even know what happened to them, before they had the chance to even call for help. They shot themselves 30 minutes. One of the things that we know about people who attempt suicide, who get stopped, is that 97% of them are really glad you stopped them, and most of them will never try to kill themselves again. It is a very tiny period where you're at risk for hurting yourself. There's a really big period where you know you're not doing well. If you want to reduce death, you and your buddies watch out for each other and just make an agreement. Right? Then ain't nobody got to take your weapon. We don't have to have crazy laws. People don't die. Seems to me like it's reasonable. And then we have something called exposure to trauma. So what do we know about killing yourself or other people? Is that an easy thing to do?
Yes.
Good for you. Most people, it's not, right? Most people, you have to actually train yourself or practice in some way crossing the line to hurt yourself or crossing the line to hurt somebody else. So people who attempt suicide, we think, well, maybe it's a cry for help. And it certainly is a red flag for help. But we know that some people practice and they rehearse for suicide. I like to help people with something called borderline personality disorder. They attempt suicide many, many times. People quit caring about their suicide attempts because they're so frequent. And they're like non-severe, you know, like, oh, you just scratched the surface of your skin, maybe you didn't mean it. 10% of people with that disorder die by suicide. If you got diagnosed with something that 10% of the time killed you, would you take that seriously? If your doctor said, I just diagnosed you with a scary long word, but good news, 90% of the time people live. Would you be a little freaked out? Absolutely. So we have a lot of people attempt, but some of those people end up dying. When we expose ourselves to trauma, like being in combat, when we are trained to cross over that boundary, because that's an appropriate thing in combat, correct? To understand that you keep yourself safe and be able to pull that trigger and be able to do your job. When you cross over that line, it makes it easier for you to hurt yourself and someone else. And we've trained you, so we put you a little at risk. If we expose you to trauma, we put you a little at risk. Okay? Be aware that those are some of the really main risk factors. We've had some interesting trends. I'm going to talk a little bit about the social medias. By the way, before I go on, get out your phones if you have your phones. If you want to be my pal on Facebook, and I really do want to know you, I like try to keep in contact. If you have questions about what I said today, I am happy to answer those. I'm April Foreman on Facebook and at Doc Foreman on Twitter. Please find me if you want my card. I'll give you my card. I believe that social media is where a lot of information is explained. Where is the number one place that veterans hang out and dialogue about what's going on in their lives? Number one place.
Bar.
Facebook. Anyone know this? Park is nice. I like a park. Who's my answer? We should get a prize. What?
said
I like
bars.
bars too, but apparently I need my hearing checked. Number one place where we have a lot of veteran conversations, especially about stress. We know this, it's like crazy. We're not sure what to do about this, but very recently, Facebook search engines are now the number one search engine on the internet, right? That's the number one place people go online.
Wow.
And we have lots of conversations about veterans discussing their emotional distress on Facebook. I want you to learn something really, really quick. How many people know that if you see something that freaks you out about someone in your unit or someone that you love, veteran that you love on Facebook, that you can have somebody immediately look at that post and follow up with them without you having to do anything awkward? Do y'all know this? Good for you. Like what you do is you go into Facebook, and I happen to know the folks who organize this, and I happen to have tried this once. I tested it out, and I had people calling me like immediately. It's crazy business, but it's true. You can search for the word suicide. This is a screenshot of the menu that comes up. There's one that, like, how do I help somebody in the military? They're going to give you immediate advice about what to do. They're going to show you how to report if you're worried about a post on Facebook, something that caused you to be really worried about someone's safety. If you can, please call 911, but if you're not sure, we can send this. Those reports go through Facebook directly to the National Suicide Prevention Lifeline. And the National Suicide Prevention Lifeline works with the VA, and they will, if it's a veteran, they will find them and they will find out where they live if they know, and they will actually alert me or whoever is assigned to their area, and I will follow up in one business day. They'll try to make sure they're safe that night, and someone will call and make sure that they get immediate help and contact. Did you know this? On the Facebooks, you don't even have to know me. You don't even really have to know the person. If you see someone freaks you out, and makes you a little concerned, this is the place to go. If someone's in immediate danger, though, what do I want you to do? 911, immediately. Call 911 if you're worried. Don't wait. Don't pass go. Call 911. Worst case scenario, the police are ticked at you and it's not a problem, and your friend probably won't make that funny joke about killing themselves again. But if you're not sure, Facebook is a wonderful way that has provided things like this. And by the way, it's not just Facebook. Most of these resources are everywhere. I want to tell you about an additional trend. Remember, we talked about trauma puts people at risk. I know that none of you have done this, right? How many of you have smartphones? How many of you had smartphones while you were deployed? And none of you took video you weren't supposed to take of your combat or deployment experiences, right? Because you've all done the right thing.
Correct.
But it turns out there's this trend, and we've only become aware of this very recently, and nobody's really started researching this, and I know because I've gone to all the fancy conferences and started asking the very fancy, famous researchers about this. It turns out there's this phenomenon going on we're not sure about. What's happening, and some of you probably already know this, is people who have been deployed have been uploading helmet cams and various pictures of traumatic experiences or a day in the life deployed. Did you guys know this? Mm-hmm. You all knew this, right? This isn't a surprise to you. This was a surprise to all the folks who didn't know. I'm going to tell you, when I tell other folks who are not you, they're all shocked. And when I go online and I Google these things, or I YouTube search them, I can find thousands of posts. I can find, most of these posts have 80,000 to a couple million hits. Nothing I do gets more than a few hundred hits. Your combat experiences, millions of hits. And here's what we know is happening. Not everybody, but we know that some folks are going online and they're sharing these on Facebook. And their Facebook pages that just show this, and they'll say you only feel alive in a firefight, and they'll post them. And it turns out that there are some folks who are watching these compulsively, and we don't know. The people who are supposed to know, I'm going to tell you right now, they don't know what that does to you. We are concerned that it may be lowering your threshold for ability to hurt yourself and other people, because watching a violent, traumatic thing over and over and over again may not be good for you. And then someone's like, well, maybe it helps you cope. I've heard all sorts of things. The truth is, and nobody even knew it or was studying it until a few months ago when I started bringing it up at conferences, and people were like, this happens. I can go online, I've already done this, I've got them downloaded on my computer. I can find your unit, your experiences, and videos from your deployment. Take me 10 minutes, I can show you people you know. I've already done this for sergeant majors. Freaked them out. They were like, oh my gosh, that was our deployment. I'm like, yep. I have a guy who helps me do these searches who's very clever. I find pictures of your traumatic experiences immediately. We don't know what this does, but we think it may be increasing risk for suicide. There are some resources for you. And I'm going to tell you, I'm going to tell you about the one that I'm involved with, but the truth is there are tons of resources. Anybody overwhelmed by the number of help numbers people are giving you to call?
Oh.
You should be. There are a lot of numbers, right? One of the things that I've been told repeatedly by veterans is we give you too many places to call, too many things to do. It's confusing. The number one clearinghouse, if you remember no other number, call this number please. 1-800-273-TALK. That's the National Suicide Prevention Lifeline. If you press 1, you will get someone trained to help someone who's a veteran, who's in the military. If you give them permission, or if they're very concerned about you for your safety, I will get an alert, and me or someone just like me will respond within 24 business hours. We will check out what's going on, even if you're not suicidal. We have a lot of calls that are, I've been abusing a lot, I've been drinking a lot of alcohol, or abusing a lot of, unfortunately, a lot of painkiller abuse has been going on. My life's a real mess. I'm about to be homeless. I had a fight with my wife again. My wife is pregnant, and it's another guy's baby, and I just found out. You get those? And my goal is, I got 24 business hours to figure out the places you need to go and what I'm supposed to get to you. You need to make me work harder so I can hire more of me. Okay? Call the number. We would prefer you call before it gets bad, because I can immediately get you in touch with the resource. Even if you're not a veteran, even if you're not enrolled in the VA, I will get you somewhere. That's my job. So this is, now see the dark scary woods, forest for the trees, right? I don't need you to surrender all your guns, come cry and hug me and tell me about how bad your mom was to you were a kid. I'm assuming none of you here want to kill yourselves, none of you here are suicidal, maybe you are, but I'm going to assume none of you are. I'm going to assume that you're the ones who are here, you've been to the Yale Ribbon, you're healthy, you're ready for post-deployment. But there is somebody you know who isn't. And here's the deal, I've been doing this a little while. I have not met anyone who doesn't know someone they're worried about. Right? Not met anyone. I want you to be aware of the resources. Do not be afraid to use the suicide word. It's not magical. It doesn't have any special powers. It's not a dangerous word. It's okay to ask. People are usually relieved if you ask them if they've been thinking about that. It's okay to talk about it when it happens. It's not taboo. It's okay to ask the question, have you been feeling suicidal lately? Because in your gut, and this is trust your gut, in your gut, sometimes you know when something's wrong. How many times have you been taught to trust that feeling? Trust that about the people in your unit. Trust that about the people you care about. Know how to get help. Use the crisis line. Understand where your local resources are. If you ever wonder where they are, be my friend on Facebook, right? Because I've asked you to be my friend on Facebook. I've had people just message me, and I get them a message right back. I want you to be able to find me. I want you to also get lunch. This is how you get a hold of me. There's my email at work. My Facebook, that's my Twitter. If you want my phone number, I want you to be able to find me anytime you want me and get anything you need. I appreciate your attention. Now go get some meat.
Thank you.